Xiel are producing a series of videos called 6 Questions 2, where we are interviewing a number of our solution users who are leading in their field to understand how they are working and where they see the future of the technologies discussed. Today we're interviewing Ben Allen, the technical lead radiographer at Queen Elizabeth Hospital in Birmingham, and asking Ben 6 questions on abdominal compression. How are you doing, Ben?
I'm well, thank you. How are you?
Yeah, I'm good, thank you. Which abdominal compression equipment did you go with?
We went with Civco Body ProLock 1 with the couch overlay. We reviewed several on the market at the time, and just with the nature of abdominal compression and the fact that you're putting pressure on these patients, we wanted one that was robust enough to take that pressure, but also flexible enough to put into positions that we wanted to put it into. And that's how Civco scored the highest when we sort of ranked them. The couch overlay, we had a different CT couch compared to our treatment couch, and the couch overlay meant that the arch was compatible with both couches, so it could be used on both of them. So that was good as well.
Can you please share your experiences with the Civco equipment so far? Have you noticed any unique benefits with this technology?
We wanted it to go down the abdominal sabre route when commissioning through evaluation started off sort of 4 or 5 years ago. So that is our main use of the equipment. It launched us into commissioning through evaluation. I think a quick look the other week, I think we've done a couple of hundred abdominal compression sabre patients in it now, so we've got a fair amount of experience using the equipment, and it's still doing the job we need it to do. We've also done some small studies to look at the tumour motion with and without abdominal compression, and we've shown that there is a reduction of the PTV volume when using the compression arch as opposed to not.
Which patient groups have directly benefited and how from the introduction of abdominal compression into your department?
So the first patient group we started using it on were the liver patients for commissioning through evaluation, liver mets and HCCs. So that's where we started, but we also quickly moved on to treating adrenal patients. And we've also used it on some lung patients for the lung sabre tumours that are just on the diaphragm and moving quite a lot. We have used the abdominal compression to try and reduce that motion also.
What future plans do you have with using this equipment, such as in trials, with the use of new treatment techniques, treating new patient groups?
So the main one we're looking at the moment is we've treated a few of them. We're doing a novel treatment technique for renal sabre, and the abdominal compression is again key for treating that. So that's what we're working on at the moment, and we're getting some data together out of the patients that we've treated so far.
With the pending national rollout of sabre in the UK, do you see the Civco equipment playing a vital role in supporting this? If so, how?
Yeah, I do. Sabre's been restricted to certain radiotherapy centres for a long time now, and now that it's opening up to other centres, I think you need to be able to have that motion management to accurately treat these tumour volumes, and keeping the volume that you're treating, keeping it small, and knowing where you're actually treating. So I think an abdominal compression technique is key for any sabre technique in the abdominal area. I mean, we haven't done it much, but you could also use it on nodal volumes there as well. So I think you need some sort of motion management to safely treat these patients, and this is perfect for it.
How was the service you received from Xiel and Civco in terms of like communication you received or offered, training you received or offered, and like delivery timelines?
Yeah, it was absolutely spot on. We've never had any problem with the equipment to go back to Xiel for, apart from slight wear and tear, but we just get the part sent through the post like the next day. It hasn't stopped us using the equipment clinically. The training was quick and easy. It's all been perfect, really, as needed.
Thanks for your time today, Ben. It's been very useful.
No worries.
Take care.